I'm Cynda Rushton. I'm a professor of clinical ethics and nursing at Johns Hopkins University. And I am privileged to be part of the core faculty of UPIA's GRACE program with Tony Bach and Roshi Joan Halifax. I want to share today how you might use the elements of GRACE, the mnemonic that Roshi Joan has created to help us to be able to create the conditions for compassion to arise in a very complex, uncertain environment that we're currently in. You'll remember that GRACE is a mnemonic that stands for 5 elements. The first is gathering our attention. The R of GRACE is recalling our intention. The A is attuning first to self and then to other. The C of GRACE is considering what will serve, and the E is about enacting and ending. So I want to use those elements to apply it to a situation that may be quite common for those of you at the front line right now. Imagine yourself confronted with a family member of one of your patients who has been admitted to rule out the COVID virus. In many of our institutions, that means that visitation is limited. And it can create a lot of angst and anxiety for us as we try to explore how we might respond when the family member says, "Why can't I visit? This is a time when I need to be with my loved one." So if we apply the elements of GRACE, the first is to gather our attention, to be able to actually tune into our breathing, to notice the inhale and the exhale for just a few breaths. Inhaling and being able to drop into the body to notice how we are right now in this moment can help us to be able to calm our nervous system so that we can begin to explore how we might respond to this request. So taking a deep breath, filling our lungs and just allowing the breath to slowly exhale is the beginning of creating the foundation for us to respond rather than react. The R of GRACE is about recalling our intention. And this has been a really important anchor for many of us as we consider how we might respond to that family member's request. Gathering our attention and then recalling, why are we here? Why have I chosen this path of service? What are the values that I uphold in my practice as a clinician? How do I connect to the ethical foundation of our work as clinicians? And one of those important values is compassion. How can I actually bring compassion into a situation where there's so much confusion, there's so much anger often and negative energy? How do I bring compassion into my service right now? So gathering my attention, recalling my intention. And then what may seem counterintuitive is to attune first to ourselves. How am I showing up right now? And I can imagine in myself how I might respond in that situation, probably noticing some constriction in the body somewhere, for me in the chest, noticing how my breathing feels a little more constrained. My heart's beating a little bit faster. But noticing that, noticing what I'm feeling right now, maybe a sense of sadness that I can't perhaps meet the needs of this family member. And noticing where my mind goes, what my thinking patterns might be, whether they be positive or negative. It might be something like, I can't believe I have to do this right now. I can't believe I'm in this situation. Or it might be being able to actually consider, what it might be like for that family member. And that's the second part of A, is actually enlarging our awareness to include the other. So being able to empathize, to be attuned to the experience of this family member, to be able to imagine what it might be like for them, what they may be experiencing. So both that affective attunement, but also cognitive attunement. So enlarging our perspective to include that other person. Then the C of grace is considering what will serve. And this is a place that's really grounded in clinical humility, our ability to let go of what we think it ought to be, and to step back and give ourselves space to reflect on what will serve in this circumstance. That's different from what I want or what I actually think ought to happen, but actually what will serve in this moment. So being able to create space to actually notice where our biases are, to notice where assumptions may be arising, where we may be attached to thinking that the only way that I can serve is by doing one particular action. So considering what will serve is a very important place to actually pause and to ask that question intentionally, and to give ourselves space to be surprised, to discover something new that maybe we hadn't considered in the past. And that might be a place where we consider, on the one hand, I might want to actually bend the rules a little bit and to allow this family member to stay because they are so distressed. And on the other hand, I know I have an obligation to the health and the well-being of everyone, not only this patient, but my other patients, the colleagues that I work with, and the broader community. So being able to discern in that moment what will serve is vital to being able to bring compassion into our work. The final phase of grace is going from considering to enacting, to actually be able to take the step from considering to being able to actually take action, or in some cases, to not take action. And so inaction really, it requires skillfulness, and it requires our ability to really find the right path for us to have integrity in the midst of these challenges, to do that in a way that's ethically grounded. So in this circumstance, what we might consider is, how will I speak to this person? How might I be able to convey to them, for example, the risk of spreading this virus is so high that unfortunately we can't allow visitors. And it's not only for the protection of your loved one, but it's the protection of everyone. And we're sorry that we can't allow you to visit right now, but I'd like to explore with you ways that you can be connected to your loved one, even when you can't be present here. I know this is really important to you. And it's important to us that our patients have the connection with the loved ones that matter most to them. It's just not possible right now. And so being able to move from considering into action is really vital to being able to enact ethically. And then an important dimension of E is actually being able to end the encounter and to release in whatever way we need to move from that encounter to the next encounter without carrying the weight of that with us. So being able to pause, to thank the person, to acknowledge our effort and our ability in this moment to be able to maintain our sense of integrity is really vital. So these elements of grace really are an anchor. They are a resource for us in the midst of complexity and chaos. And we offer these to you with deep gratitude for what you are doing every single day and in the very challenging circumstances that you find yourself in. May you also extend compassion to your limitations right now and to your efforts to do the best in a very challenging situation.